Have you ever felt yourself gradually weakening, experiencing persistent fatigue with no clear reason? Or noticing your heart race unusually after just a small emotional moment? Have you found yourself climbing a few stairs, only to stop, gasping for breath, but in your mind, that familiar reassurance echoes, "It's probably just my age"? If you've ever thought that, please take a few moments to truly hear this. Not all fatigue is a sign of old age. Not all chest discomfort is simply indigestion. And not every shortness of breath means you're just getting older. Because there are silent signs that carry a critical warning, that your heart is slowly weakening. And the most dangerous part? Most of us don't even realize it. In the United States, on average, over 800,000 people die from cardiovascular disease each year. A significant portion of these are older adults who missed golden opportunities for early detection, simply because they mistook initial symptoms for normal signs of aging. But here's the truth. Your heart never lies. It always sends signals, always speaks up. The question is, are you listening? Today, I'm going to help you decipher the 7 earliest warning signs of heart disease. Signals that, if recognized in time, could preserve your health, extend your life, and secure those precious years with your loved ones. Sign 1. Persistent fatigue, even with adequate rest. Do you get enough sleep, avoid strenuous work, and have no major worries? Yet you still feel utterly exhausted. Are you losing interest in simple activities you once enjoyed? Cooking, walking, talking, or even just reading a book? This isn't laziness. It's very likely a sign of a weakening heart. When your heart can no longer pump blood efficiently, your brain and muscles don't receive enough oxygen. The result? Your body enters a state of chronic, unexplained fatigue, a weariness that doesn't recover, no matter how much you rest. And what's terrifying is how subtly this feeling progresses. People gradually become less active, stay home more, and attribute it to old age, completely unaware that their heart is slowly running out of steam. Sign 2. Shortness of breath during activity or when lying down. Do you ever find yourself out of breath after climbing stairs, walking slowly, or carrying something light? Have you ever lain down in bed, only to find yourself needing to sit up to breathe more easily? These are signs of mild pulmonary edema due to heart failure. When your left heart weakens, blood isn't pumped efficiently out of your lungs, causing fluid to build up, making it difficult to breathe. If you frequently need to prop yourself up with extra pillows to sleep, or feel a suffocating sensation when lying on your side, your heart might be calling for help. Sign 3. Mild, fleeting chest pain with no clear cause. Not everyone with heart disease experiences severe, crushing chest pain. Many patients only feel a slight twinge in the center or left side of the chest, sensation of pressure, or a brief squeeze that lasts only a few seconds before fading. Vague chest tightness when emotional, in cold weather, or when walking gently uphill. Because the pain is mild, it's easy to dismiss or mistake it for indigestion or muscle strain between the ribs. But never forget, myocardial ischemia, reduced blood flow to the heart, doesn't wait for severe pain to become dangerous. Even if just 70 to 80% of a coronary artery is narrowed, the risk of a heart attack can occur at any moment. Sign 4. unexplained rapid heartbeat, or irregular rhythm? Are you at rest, but your heart suddenly starts pounding rapidly, forcefully, as if someone is knocking on your chest? Or do you feel your heart skip a beat, followed by a strong compensatory beat? Many people assume this is just a temporary emotional reaction. But if it happens frequently, it could be an arrhythmia, one of the leading causes of transient ischemic attack, actual strokes, and even sudden cardiac death. The older you get, the higher your risk of arrhythmias. Don't dismiss an abnormal heart rhythm. That's your heart's language crying out for your attention. Sign 5. Dizziness, blurred vision, or feeling faint. These are symptoms of temporary cerebral ischemia, which occurs when your heart isn't pumping enough blood to your brain. You might feel your eyes spin, ears ring, or limbs go weak, often appearing when you stand up too quickly, step out into bright sunlight, or suddenly feel lightheaded while doing light activities. If you experience these symptoms repeatedly, don't just blame low blood pressure. Consider the possibility of heart failure, an arrhythmia, or abnormal heart valves. Sign 6. Swollen legs, or rapid weight gain in just a few days. Do you notice your shoes feel tighter by the end of the day, or your ankles are slightly swollen? Or have you gained 2 to 3 kilograms, 4 to 6 pounds, in just 5 to 7 days, even though you haven't eaten more than usual? These are signs of fluid retention due to right-sided heart failure. When the heart can't pump blood effectively, fluid gets trapped in the tissues, especially in lower extremities like your legs. Heart-related swelling usually isn't painful, but if left unaddressed, it can severely impact the function of your heart, kidneys, and lungs. Sign 7. Insomnia. Waking up mid-sleep due to shortness of breath or palpitations. Have you ever been in a deep sleep, only to suddenly wake up with a suffocating sensation? Do you find yourself needing to sit up to breathe, your heart pounding rapidly, feeling inexplicable anxiety? Many people might dismiss this as a nightmare or just general anxiety. But in reality, these are symptoms of nocturnal heart failure. When you lie down, more blood returns to your heart. If your heart is weak, it can't pump this blood fast enough, leading to shortness of breath, anxiety, and sweating. If you consistently need to prop yourself up with 2 to 3 pillows to sleep, or frequently wake up in the middle of the night gasping for air, consider this a serious warning sign. Your heart doesn't speak in words. It communicates through sensations, through its rhythm, through your breath, and through your fatigue. And if you listen deeply enough, you will recognize when something isn't right. Differentiating chest pain, heart versus stomach. Don't get it wrong. A small mistake could cost a life. After we've explored the 7 early warning signs of heart disease, there's another crucial, even life-saving piece of information. How do you tell if the chest pain you're feeling is from your heart or just your stomach? This seemingly simple question has led countless individuals into dangerous situations, all because of a critical mix-up. Many people, when they feel chest tightness or pain, simply think, must be indigestion, or probably just acid reflux again, and then they take antacids, lie down, rub their chest, waiting for it to pass. But tragically, that very pain could be the first sign of a heart attack. Heart-related chest pain, signs you cannot ignore. Chest pain caused by the heart, especially due to myocardial ischemia, reduced blood flow, or a heart attack, typically has these characteristics. Location of pain? It's usually in the center of the chest or slightly to the left, often described as a heavy pressure, squeezing, or tightness. It can feel like an elephant sitting on your chest. Duration of pain. It lasts anywhere from 5 to 20 minutes or longer, and it doesn't change when you take a deep breath or change your body position. Radiation. The pain can spread to your left arm, neck, jaw, shoulder, or upper back. Accompanying symptoms. You might experience shortness of breath, cold sweats, nausea, dizziness, rapid heartbeat, or unexplained anxiety. When it appears, it often occurs during physical exertion, strong emotional stress, or sometimes, surprisingly, when you're at rest. Particularly dangerous is the silent heart attack. It doesn't present dramatically with intense pain. It might just be a fleeting ache lasting a few minutes, feeling like a heavy sigh, yet this can be the start of a stroke or cardiac arrest. Life-saving principle. If you experience any chest pain accompanied by shortness of breath or cold sweats, call 911, emergency services, immediately. Do not hesitate. Stomach-related chest pain. Easily confused. Less dangerous. In contrast, chest pain originating from the stomach, commonly seen with GARD, gastroesophageal reflux disease or ulcers, has these characteristics. Location of pain. It's usually in the upper abdomen above the navel, below the breastbone, sometimes radiating up into the chest. Sensation. Often described as a burning, scalding sensation, accompanied by burping, acid reflux, or a sour taste in your mouth. Timing. It typically occurs after a large meal, when lying down or when bending over. Relief. The pain often lessens when you take antacids, sit up, or walk around gently. No accompanying symptoms. It usually does not come with shortness of breath, cold sweats, or pain radiating to your arm. This is a crucial distinguishing factor. However, it's important to note that these symptoms can sometimes overlap, and patients, especially older adults, can easily be misled. Common misdiagnoses and the price paid. Consider this real-life scenario. A 68-year-old man came to the hospital experiencing a dull ache in his central chest, accompanied by mild bloating after dinner. He thought it was just overeating. His wife gave him stomach medication and rubbed warm oil on his abdomen. 2 hours later, he collapsed in the bathroom, rushed to the emergency room in acute myocardial infarction, with a completely blocked coronary artery. He was fortunate to survive because he received timely emergency care. But not everyone is so lucky. A small mistake, a moment of complacency, could cost you the rest of your life. Why are older adults easily confused? Slower nervous system response. Older adults may perceive pain less intensely than younger individuals. Complex underlying conditions. Conditions that affect the nervous system can contribute to cognitive problems in older adults. Challenges with memory and orientation. As we age, we may struggle to remember where we are and our surroundings. Complex underlying conditions. It's common for older adults to have both stomach issues and heart disease simultaneously, complicating diagnosis. Tendency to endure. Many older individuals tend to tough it out, take a pill and hope it passes, or are reluctant to bother their children or doctors. Lack of medical knowledge. They may not know when a pain truly indicates danger. For these reasons, any chest pain, especially in individuals over 50, must be considered serious until a doctor definitively rules out a cardiac cause. What to do if you suspect heart-related pain? Immediately stop all activity, sit or lie down in a semi-reclined position. Call 911 emergency services or get to the nearest medical facility without delay. If you have nitroglycerin prescribed by a cardiologist previously, take it immediately under your tongue. Do not self-medicate with stomach pills or painkillers until the cause is identified. Dangerous phrases to avoid. It's probably just indigestion. I'll go to the doctor tomorrow. It'll pass if I just rest. I'll just take a stomach pill and go to bed early. All these thoughts could put your life in extreme danger. 6. Crucial cardiovascular tests for adults over 50. Do them annually. Regular blood pressure monitoring. Your silent alarm clock. High blood pressure is the leading cause of heart failure and stroke. You should monitor your blood pressure at home at least twice a week. In the morning, after resting for 5 minutes. The safe range to maintain is typically below 130 mercury over 80 millimeters of mercury. If your blood pressure is consistently higher than this, don't wait for complications to arise. Act now. Blood lipid cholesterol test. Checking for artery hardening. Here are the numbers you need to pay attention to. LDL, bad cholesterol. Ideally below 100 milligrams per deciliter. HDL, good cholesterol. Aim for above 40 milligrams per deciliter for men and above 50 milligrams per deciliter for women. Triglycerides. Keep these below 150 milligrams per deciliter. You should get your blood lipid levels checked annually, especially if you are overweight, lead a sedentary lifestyle, or have a family history of heart disease. Electrocardiogram, ECG, EKG, detecting irregular heart rhythms and myocardial ischemia. This quick 5-minute test can reveal dangerous heart rhythm disorders, atrial fibrillation, and heart enlargement, all potential factors for sudden cardiac death. Even if you don't have symptoms, get an ECG at least once or twice a year. It's a simple, non-invasive snapshot of your heart's electrical activity. Echocardiogram, heart ultrasound, assessing your heart's pumping power. A heart ultrasound allows your doctor to visualize the function of each heart chamber, your heart valves, blood flow, and the strength of your heart's contractions. This is especially important if you have a long history of high blood pressure, diabetes, chronic shortness of breath, or prolonged unexplained fatigue. It provides vital information about your heart's physical structure and how well it's working. Blood pressure then. If this ratio is low, it strongly suggests you might have narrowed blood vessels in your legs, which means your coronary arteries, those supplying your heart, could also be affected. It's a quick, non-invasive test that gives insight into your overall arterial health. Coronary CT angiography, carotid artery Doppler. If you're high risk. Not everyone needs these advanced tests. But if you experience recurring chest pain, long-standing diabetes, smoking history or high cholesterol, a family member who had an early stroke or heart attack, then absolutely ask your doctor to consider these specialized screenings. They can provide detailed images of your arteries and pinpoint blockages. Prevention is better than cure, especially after 60. People often say, old age is a downhill slide for health. But the truth is, it's never too late to start living healthy. If you are 60 or older, this is your golden opportunity to drastically reduce salt, sugar, and unhealthy fats, and focus on eating more green vegetables, fish, and fresh fruits. Engage in light physical activity every day. Just 30 minutes of walking or practicing yoga or dancing can make a huge difference. Get enough sleep, 6 to 7 hours nightly, and avoid staying up late. Prioritize consistent sleep patterns. Get regular health checkups every 6 months. Even if you feel perfectly healthy, don't skip these. Maintain a positive mindset. Reduce anxiety, embrace a slower pace of life, and dedicate time to yourself and your loved ones. Remember, heart disease doesn't just appear overnight. It develops from small, repeated habits accumulated over decades. 7 daily habits. For a healthy heart, no meds needed. Here are 7 simple habits you can incorporate into your daily routine to support a strong, healthy heart. 1. Warm water after waking up. This helps thin your blood and prevents early clotting. 2. Chew thoroughly and prioritize boiled steamed dishes. Reducing the burden on your digestive system and consequently your heart. 3. Walk outdoors for under 200 minutes daily. Boosts in your heart's blood circulation and helps lower blood pressure. Laugh. Laugh every day and talk with loved ones. Helps relieve stress and stabilizes your heart rate. Before 10. This allows your nervous system and heart to recover after a long day, to help to brushes. This can lower blood pressure and increase oxygen supply to your brain and heart. One thing you're grateful for each day. Simple practice helps you appreciate life more, fostering a positive outlook that benefits your overall health, including your heart. Your heart doesn't ask for much. It just needs you to listen a little, care a little, and adjust a little. Every single day. Don't wait until it cries out for help with excruciating chest pains, fainting spells, or shortness of breath in the middle of the night. Start today, right now. A glass of warm water, a healthy meal, a simple walk. These seemingly small things are precisely the threads that connect you to a peaceful, healthy, and happy life alongside the people you cherish. If you found this video helpful, please hit the like button and share it with your loved ones, especially the older adults in your life. And make sure to subscribe to our channel so you don't miss out on future videos, where we're always here to support you on your journey to live healthy and live joyfully.